Welcome to Public Health Brief. Bedwetting, also called enuresis, is a challenge faced by millions of children and even some adults around the world. While many think of it as just a childhood phase, the truth is that enuresis is a real medical condition with clear causes, proven treatments, and effective ways to stop it. In this video, we uncover everything you need to know about why bedwetting happens, what it really means for health, and the best solutions to overcome it. From the science of bladder development and hormones to the emotional impact on families, we'll give you trusted information and practical advice that works. If you've been searching for answers about enuresis, you're in the right place. Enuresis is defined as involuntary urination, particularly during sleep, in individuals who are old enough to have achieved bladder control. While it is most commonly seen in children, it can sometimes persist into adolescence or adulthood, creating long-lasting challenges. To truly understand why bedwetting occurs, it's important to consider both the science of how the urinary system develops and functions, and the psychological and social dimensions of living with enuresis. Bedwetting is not simply about laziness, bad behavior, or poor parenting, as some myths suggest. It is a condition with biological, neurological, and sometimes emotional roots, and dismissing it as a habit only makes it harder for families to address. Enuresis is defined as involuntary urination, particularly during sleep, in individuals who are old enough to have achieved bladder control. While it is most commonly seen in children, it can sometimes persist into adolescence or adulthood, creating long-lasting challenges. To truly understand why bedwetting occurs, it's important to consider both the science of how the urinary system develops and functions, and the psychological and social dimensions of living with enuresis. Bedwetting is not simply about laziness, bad behavior, or poor parenting, as some myths suggest. It is a condition with biological, neurological, and sometimes emotional roots, and dismissing it as a habit only makes it harder for families to address. One of the most fundamental aspects to grasp is that enuresis is divided into two main types, primary and secondary. Primary enuresis refers to a situation where a child has never fully achieved nighttime bladder control. These children may be perfectly healthy otherwise but continue to wet the bed beyond the typical age when bladder control is expected. Secondary enuresis, on the other hand, occurs when a child or adult who had already achieved bladder control for several months or years suddenly begins wetting the bed again. This distinction matters, because the causes behind each type can differ, and identifying whether it is primary or secondary enuresis helps healthcare providers guide families toward appropriate solutions. The development of bladder control is a complex process involving both the muscles of the bladder and the communication between the brain and urinary system. In some children, this communication develops more slowly, meaning they may not recognize the sensation of a full bladder while asleep. This neurological immaturity is one of the leading explanations for primary enuresis. In these cases, bedwetting is not the result of willful behavior or negligence, but simply a matter of the body not yet reaching the necessary developmental stage. The good news is that most children outgrow primary enuresis naturally as their nervous system matures, though for some, the process can take longer than average. Genetics also plays a powerful role in enuresis. Research shows that if one parent experienced bedwetting as a child, the likelihood that their child will also experience it is significantly higher. If both parents had enuresis, the probability increases even further. This hereditary link suggests that the tendency toward delayed bladder control may be encoded in our DNA, meaning that some children are more predisposed to it from birth. Families should therefore never view enuresis as a moral failing or parenting mistake but rather as part of a complex biological legacy. Another factor to consider is the bladder's capacity. Some children with enuresis may simply have a bladder that is smaller than average or that does not expand enough to hold the urine produced overnight. If a child produces more urine than their bladder can hold during sleep, and if they are unable to wake up when their bladder is full, bedwetting will naturally occur. Additionally, the hormone vasopressin, also known as the antidiuretic hormone, normally signals the kidneys to produce less urine at night. In some children with enuresis, this hormone may be produced in insufficient quantities or may not function effectively, leading to an overproduction of urine while asleep. Secondary enuresis often has different causes and should be carefully evaluated. A child or adult who previously had dry nights but suddenly begins wetting the bed may be experiencing stress, anxiety, or emotional disturbances, Life changes such as the arrival of a new sibling, divorce, moving homes, or starting a new school can create emotional turmoil that manifests in bedwetting. In other cases, medical issues such as urinary tract infections, constipation, sleep apnea, or even diabetes can lead to secondary enuresis. That's why medical evaluation is essential, especially when bedwetting begins suddenly after a long period of dryness. Beyond the physical and biological explanations, the emotional impact of enuresis is profound. Children often feel shame, embarrassment, or fear of being discovered by siblings or friends. Many avoid sleepovers, school trips, or overnight camps to hide their condition, leading to social isolation. Parents, meanwhile, may experience frustration, exhaustion, or guilt, sometimes mistakenly blaming themselves or their child. The cycle of secrecy, punishment, and shame can make the condition even harder to overcome. It is crucial for families to understand that enuresis is not caused by laziness, stubbornness, or deliberate misbehavior, but is instead a medical and developmental issue that requires compassion and patience. When it comes to treatment and management, the first step is always reassurance. Families must know that enuresis is common, natural in many cases, and resolvable. Pediatricians often remind parents that the majority of children outgrow bedwetting with time. Still, for families who wish to actively address the problem, there are many evidence-based strategies available. Bedwetting alarms, for example, have been one of the most effective tools developed in modern medicine for treating enuresis. These small devices detect moisture in the child's underwear or bedding and emit a sound or vibration to wake them up when urination begins. Over time, this trains the child's brain to recognize the sensation of a full bladder and wake up before urination occurs, gradually establishing bladder control during sleep. In addition to alarms, certain medications may also be prescribed in specific cases. Desmopressin is one such medication that mimics the action of the natural antidiuretic hormone, reducing urine production at night. While effective, it is usually prescribed for older children or for specific situations such as overnight stays, because it does not cure enuresis permanently but rather helps manage symptoms temporarily. Another medication, imipramine, has also been used, though its use is less common due to potential side effects. Behavioral strategies are equally important in addressing enuresis. Encouraging children to use the bathroom regularly during the day, limiting fluids before bedtime, and ensuring they void their bladder right before sleep are simple yet helpful measures. Addressing constipation is also critical, since a full bowel can put pressure on the bladder and reduce its capacity. In families where stress or emotional disturbances are suspected causes, counseling or therapy can play a vital role in both reducing anxiety and giving the child coping mechanisms to feel more in control. Support and encouragement are perhaps the most vital components of overcoming enuresis. Punishment, scolding, or shaming a child for wetting the bed only deepens feelings of inadequacy and does not solve the underlying issue. Instead, parents should focus on celebrating progress, whether it is a dry night or consistent effort in using strategies. Building confidence and removing guilt can accelerate the process of recovery and help the child feel secure. In cases where enuresis persists into adolescence or adulthood, medical consultation is especially important, as the underlying causes may be more complex. For adults, enuresis may signal chronic conditions such as sleep disorders, diabetes, or bladder dysfunction, and identifying these early can prevent more serious health problems. Adults living with enuresis also face unique challenges in terms of relationships, intimacy, and self-esteem, making open dialogue with healthcare professionals crucial. Culturally, enuresis is often surrounded by stigma and silence, with many families reluctant to speak about it openly. In some societies, bedwetting is still seen as laziness or disobedience, leading to harsh punishments that only harm the child emotionally. Raising awareness and promoting accurate information about enuresis can help break these myths and ensure that children receive the empathy and medical attention they deserve. The future of enuresis treatment continues to evolve with advances in medical research. Scientists are studying new ways to better understand how the brain communicates with the bladder, exploring genetic factors more deeply, and refining behavioral therapies to suit different age groups. The integration of technology, such as smart bedwetting alarms connected to mobile apps that track progress, is offering new tools for families to monitor and manage the condition. These innovations promise to make treatment more effective, less stressful, and more personalized for each child. Ultimately, the journey through enuresis is one that requires patience, compassion, and persistence. While most children will outgrow bedwetting naturally, for those who don't, there are effective treatments available that can bring relief and restore confidence. Families must remember that they are not alone, that millions of children and adults share this experience, and that solutions exist. By replacing shame with understanding, frustration with support, and secrecy with openness, enuresis can be addressed not just as a medical condition, but as a challenge that can be overcome with the right knowledge and care. So our conclusion is, if you or someone you know is living with enuresis, remember this: bedwetting is not the end of the story. It is not a permanent label, nor is it a reflection of character or worth. It is a temporary stage in most cases, and in others, it is a condition with identifiable causes and solutions. With the right medical guidance, family support, and persistence, enuresis can be managed, reduced, and even cured. Enuresis, or bedwetting, is not a weakness, laziness, or bad behavior. It is a medical and developmental condition that can be understood, managed, and eventually overcome. By learning about the real causes of bedwetting, from genetics, bladder capacity, and hormone balance to stress and medical conditions, families can replace frustration with knowledge and hope. The good news is that most children naturally outgrow enuresis, and for those who don't, there are effective solutions such as bedwetting alarms, lifestyle changes, medical treatments, and emotional support that truly make a difference. The most important recommendation is to approach enuresis with patience, compassion, and persistence. Parents should avoid punishment or shame, and instead encourage progress step by step. Seeking medical advice when needed ensures that underlying conditions are not missed and that the child or adult receives the right support. Remember, you are not alone. Millions share this experience, and solutions are available. If you found this video helpful, we recommend you share it with other parents, families, and caregivers who may also be searching for answers. And don't forget to like this video, subscribe to our channel, and turn on notifications so you never miss trusted health education content that can make a real difference in your life. Together, we can break the stigma around enuresis and support healthier, more confident futures.